The older we get, the number of stem cells drops down straight line from 1 in 10,000 when we're born to 1 in 100,000 when we're teenagers to 1 in 400,000 when we're 40s and to 1 in 2 million when we're 80s. So that's why we're wrinkling up. That's why we're degenerating. If you have a weakened immune system, it's going to boost your immune system. If you have an overactive immune system, it's going to calm your immune system. He started doing stem cells and boom, his cholesterol was decreased from 300s back to normal. And he's dropped his 30 pounds because he finally had enough energy to go to the gym. And he feels like a new man.
Gives hope to a lot of people with very severe health conditions like the stories that you mentioned. It's very close to having a miracle happen to you. So as a provider, you may have some questions, some clinical questions, and also some technical questions, how to actually implement regenerative medicine as part of your practice successfully. Today, we're going to talk about the benefits of stem cell therapy and how to integrate regenerative medicine in your practice. This video may be very interesting for you and also may be very helpful because as medicine is advancing, you will also notice that there are a lot of very promising therapies that are emerging, and stem cell therapy is one of them. But because they're so new, you also, as a provider, you may have some questions, some clinical questions, and also some technical questions, how to actually implement regenerative medicine as part of your practice successfully. So if you find this video helpful, do me a favor, give it a like, comment below if you have any questions. Also follow us on social media and subscribe to our YouTube channel, Polish Your Life, because we have amazing integrative healthcare providers who collaborate to improve more lives. So I am here with a very special guest. I am here with a triple board certified physician, regenerative medicine and anti-aging expert, founder of American Academy of Integrative Cell Therapy, Uplyft Longevity Center, Chara Biologics. She's also involved in many other organizations in this space. She's a published author, amazing person. I'm here with Dr. Joy Kong. Dr. Joy, welcome to Polish Your Life.
Thank you so much for the introduction.
Thank you. Thank you for being here. So let's get started with the important question. Why stem cell therapy? What made you so interested in this subject?
Well, if you think about the history of medicine and what we've been able to use to heal people and improve their lives, we've been relying on molecules or a group of molecules, right? Either chemicals or herbs, which is really a collection of different chemicals, different molecules. This is the first time in human history that we're using the intelligence of the DNA to heal the human body. So this is why it's so revolutionary. It sounds incredible, right? But what's interesting was research have shown that it actually works. And that's what's even more powerful. What it's so inspiring for me is realizing that I'm tapping into the same intelligence that created us. So from that fertilized egg, that first stem cell, how it turned out to form this incredibly complex and beautiful human being, and how the DNA that's embedded in that first cell was able to keep replicating and directing this entire activity. So that's what we're tapping into. And that's why it's so special. And so I've been seeing it been helpful in many, many areas. Of course, there are many, many cell types, and we can get into the details, in a little bit.
Yeah, this is, like you mentioned, tapping into the power of what created us and the forces behind it. It's remarkable. It's amazing. And the technology, while it's relatively new, it is being implemented more and more. It's also very promising because, like we talk about in Polish Your Life all the time, we do what we do because there are so many people who go from doctor to doctor. Even if they follow recommendations, there are many instances that they actually are not getting better. And then what? And now we have different layers of support that are available, and that's awesome. And many of them will be very helpful. We look at the body holistically. We tap into the power of functional medicine, et cetera, and it's great. And still, at the same time, there are some people who are still not improving. And actually, stem cells is one of the promises, one of the hopes that maybe there is something else that can be done beyond all the things that we maybe know about. So maybe let's talk
Yeah,
about the benefits.
I'll tell you a story, showing the power of stem cell therapy that's above and beyond everything else that we're doing, even in the whole integrative and functional medicine space. So there's this doctor who is a hormone expert, peptide expert. He's well published, he teaches, at conferences, and he has his whole program, he owns his whole building, is a very prominent physician who has Lyme disease himself. So he has all these tools as in his toolbox, but still he was dragging his feet because the Lyme disease was affecting him to the point where he would wake up at 2 p.m. every day, barely able to finish a few emails. So, and he couldn't get rid of the extra pounds, 30 pounds. And then stem cells was introduced to him. He started doing stem cells, and boom, his cholesterol was decreased from 300s back to normal. And he's dropped his 30 pounds because he finally had enough energy to go to the gym. And he feels like a new man. And this is the power of adding the final engine to the body, because I think of everything else we're doing as the fuel for the engine. And eventually, if you have enough engine running in your body to promote regeneration, no matter what damage you did, right? If the engine is running, it can repair, replenish, and then you're new again. But if you're running out of your engine that's driving this regeneration, then you just start to degrade. So the damage, inflammation, it just pile on one upon another. So this is why we can add all the fuel there are, but if we're not addressing the engine itself, then you hit a plateau, right? And then you add the engine, all of a sudden the engine is getting these clean fuel. You need clean fuel, right? If you put dirty fuel into a Ferrari machine engine, the car is not going to drive very well. But if you have the best fuel there is, and you have crappy engine, old and decrepit engine, and your car is not going to go very well either. So you need both. And that's why, I founded American Academy of Integrated Cell Therapy, because integration is really crucial. I'm not naive thinking stem cells is going to fix everything, is end all be all. No, that is the more of the conventional linear thinking and not addressing the web of the body. Again, you've got to respect complexity of the whole body. So that's the story, about the fundamental importance of stem cell treatment, because as we get older and as we get sicker, that affects our stem cells. The older we get, the number of stem cells drops down straight line from 1 in 10,000 when we're born to 1 in 100,000 when we're teenagers, to 1 in 400,000 when we're 40s, and to 1 in 2 million when we're 80s. So that's why we're wrinkling up. That's why we're degenerating, because we don't have enough stem cells to back up the regeneration.
It's such a great analogy. And I've watched a lot of your interviews, and I think this is the first time that I heard this analogy comparing stem cells to either replacing your engine or just a secondary engine, or helping your engine go, because we do so much to maintain the engine, to make sure that the driving system of our body is okay. And yes, it's all important, right? Because we can have great engine and no fuel, it's not going to go anywhere. But if we have the fuel and then the engine itself is suffering, now having a spare engine that possibly can be there for us, or maybe some parts that we can replace in the engine that we have been using, it's remarkable. It's awesome. And I'm very, very excited that this shift in integrative medicine also right now involves things like that, regenerative medicine.
Yeah, and it's
right?
powerful, just been illustrated in anti-aging examples. So when they tested on animals, and not only consistently stem cell infusions have increased their lifespan by about 30%, but when they analyze their muscles, their brain, all the neurotropic factors, all the neurotransmitters, the growth factor levels, and waste production, everything had gone back to younger state. And that's how powerful. Yeah, it is quite remarkable. Yeah.
It is. And, the way that I'm thinking about it is we have, this cascading effect and compounding effect of all these different positive changes that happen in our body. And while we talk about 30%, yes, study was in mice, but that's how usually a lot of studies start. And then we're going to be able to see how it actually functions in humans and have enough of the proof for major medical companies and even healthcare as a system to accept it as a mainstream way of treating people. I'm just thinking about it. It sounds like a number, 30%. But what does it actually mean for a human being who is luckily maybe living to a 90 plus, maybe 100, right? And then what about the quality of these last years? It's also questionable. And now we're thinking about possibly increasing it. Possibly, I'm not saying it will do it. And by the way, if you're watching this, we are not treating any disease. We are just sharing information. We are sharing opinions. But just imagine for a second, if we could possibly increase the lifespan of a human being as well by 30%, what does it mean to the definition of what 70 is, what 80 is? It's not the end. You can do a lot as you're 80 and even 90 if you have the 30% of your lifespan actually available to you. So very, very promising. And I wanted to ask you if you could tell me some of the clinical benefits that you see very often in your clinical practice. I know you also advocate so much towards IV therapy and the systemic treatment versus just the localized injection, and we can talk a little bit about that.
I educate physicians on the evidence of IV therapy. So, and I do that with my patients because I've seen all the clinical evidence of how powerful it is. And I have a ton of examples of how it can help people. The cells do have the homing mechanism, so they know where to go. A simple IV infusion can target specific organs, and these cells are able to arrive at those places. I've seen it, arriving, in the brain, in the heart, in the liver, in the lungs, and even in testicles. It gets, and your musculoskeletal systems. So it's, that's why I advocate for IV. And it's not just because they can home into a particular area, it's because they can talk with your entire immune system. So they're able to interact with your spleen, with your peripheral lymphoid system, and promote regeneration and change the tendency of the immune system, generally from a very inflammatory to an anti-inflammatory type of shift. And we'll call it immune modulating. So if you have a weakened immune system, it's going to boost your immune system. If you have an overactive immune system, it's going to calm your immune system. So definitely, I want to, we know the immune system. If you have a good immune system, not only you're preventing yourself from infection, but also cancer and also degeneration. Your immune system is keeping your body at a healthy state. So if you can improve your immune system, then you can help all these organs to stay at a good level. So IV route not only help with the immune system, but also help local tissue.
Understand. So we are looking at the IV as a way, or stem cell IV treatment as a way to regulate this immune system, right? It's not necessarily to stimulate it to be more alert, because it depends. Some people can have overactive, some people can have underactive immune system, correct? And then the stem cells are going to regulate that activity.
Right. And how the cells do that, I have no idea. They can just do it.
Well,
this is what I'm talking about, the intelligence that created us.
Yep.
Can anyone explain that?
Yeah, chiropractors talk about innate intelligence, and I really believe that there is something there that we cannot fully understand on a chemical level or physical level or mathematical level. There is really something, the God factor that we all have in us, and it's pretty amazing that we can tap into the power of that through this type of therapy. So let's talk about some examples. So for example, there is a patient coming to you with a specific condition. What do you see stem cells working effectively for? And I know that the results may vary. We don't want to promise any result, but what do you see over and over again?
I want to make sure I'm not making any claims. I'm just sharing my, my clinical, experience. So these, of course, everybody, are supposed to consult with their primary care physician, although most primary care physicians know very little about stem cell therapy, they have no idea what kind of evidence is out there. But anyhow, that's the medical system. But what I've seen, I can give you an example of my first patient. So that would just start there. A gentleman, 69 years old, in fairly good health, but a little bit overweight, has knee arthritis. And he was told that he absolutely needed bilateral knee replacement by 2 orthopedic surgeons. So he came to me saying, well, I want to try the stem cells before I do the surgery. So what we did was I injected into each of his knee, and then I also give him an IV infusion, because for larger joints, the inner 2/3 of the cartilage is nourished by the synovial fluid. So the knee capsule with the fluid is kept pretty, in a pretty steady state, and the exchange with the blood is extremely slow. But the outer 1/3 of the cartilage is nourished by the blood supply. So by me giving IV and giving local injection, I'm targeting both sides of the cartilage. But not only that, I'm also trying to talk to his immune system to boost his overall regenerative capabilities. And that's the anti-aging benefits I was talking about. It reverts your system to a younger state. So by giving him both ends, so the next day, the knee repair took a few weeks, but what's interesting, next day he said, hey, I slept through the night. I've not slept through the night for decades, because my rotator cuff injury that I had when I was late teens, when the car rolled over, was never fully healed. So when I turn in bed, the pain will wake me up. And he didn't tell me about his rotator cuff. And I never touched his rotator cuff. But guess what? This is 6 years later. He still is sleeping through the night. The cells realized there's a screaming inflammation in that area and went over there and fixed it. Calm the inflammation first. That's the first step. And then there's tissue rebuilding that takes a little bit longer. And the last part is, basically helping his DNA to be healthier. That's the longer stage regeneration. So I talked about in my YouTube video 3 stages of healing in stem cell therapy. So there are different stages, but he got repaired. So that's my first patient, musculoskeletal. But since then, I've treated a lot of chronic conditions, people with all kinds of very severe illnesses, including pretty late stage COPD on oxygen. I was able to give people stem cell treatment, and then within a month or so, they were able to get off oxygen to the point of, some are climbing stairs when previously they could barely, walk for a certain amount of distance without huffing and puffing. And another guy went back to playing his band, and that just a life he didn't think that he will ever have again. I've helped a patient with liver cirrhosis, so end-stage liver cirrhosis. He was in hospice, really on his deathbed. He was not talking very much because he was very lethargic. And within one treatment, even on his way back to Sacramento, his swelling went down significantly. His brother told me the swelling went down on the way back. That's how fast the cells were helping him, the quick anti-inflammatory effects. And then within a couple months, he went back to his doctor and checked his liver. The functions were normal. So all the enzymes went back to normal level. And to me, that was, nothing short of a miracle. And I did not anticipate the cells to work so fast. But, and then I mentioned another, I helped somebody with a testicle problem. So this is a guy who had only one testicle left because the other testicle had nodules and kept getting infected. And so finally the urologist cut it off. And so now he has one left. Now this one is having the same problems, different nodules, marble-sized nodules, and they kept getting infected. So for 2 years, he said I had no quality of life. I just kept getting, infected, antibiotics. And and then he said, doctor, can can stem cell therapy help this? I said, I don't know, because I don't see any research on your particular condition. So I can't really give you any information. But what I do is to analyze why the disease happened in the first place. So if there's inflammation, that's part of the picture. Yes, the stem cells have significant anti-inflammatory activity. If there's fibrosis involved, yes, the mesenchymal stem cells have huge anti-fibrotic capabilities. They can break down scar tissue and prevent scar tissue from forming. And if there's a lack of blood supply, then yes, the stem cells can help you regenerate blood vessels and provide better blood supply to your tissue. If there's tissue damage and the cells are not functioning optimally, and they may be going on a path of death because there's programmed cell death, these stem cells, mesenchymal stem cells, can rescue them and can perform different functions, including mitochondria transfer, giving them fresh new mitochondria to help increase the level of energy in the cells, and then salvage them from going down the programmed cell death. So the tissue, let's say radiation damage or a stroke, some cells will be dead, but the neighboring cells will get messages to tell them to go on programmed cell death. That's the cascade, and the stem cells can prevent that cascade. And there's also anti-tumor properties. So we've seen that, there are plenty of studies actually using mesenchymal stem cells to treat cancer, and they've shown some really good results because they can tell cancer cells or senescent cells to go on programmed cell death. So they have the intelligence to tell, hey, if you're damaged and you don't have to die, I need to save you. But hey, if you're really old and you're really not functioning correctly, or you are cancerous and you are dangerous, I'm going to kill you off. So have that kind of intelligence. And of course, it has immune modulating properties. So if a person has this immune dysregulation, that's part of why they have a condition. Then the stem cells can potentially help them. So I analyze why they have the condition, even though there's no clinical studies, but I can give them understanding of whether or not the stem cells can be helpful in some way.
This is just so fascinating, and also gives hope to a lot of people with very severe health conditions, like the stories that you mentioned. It's very close to having a miracle happen to you. And yes, I know that sometimes we need a lot of double-blind studies, peer-reviewed studies, tons of them before something becomes mainstream. But it's really good to tap into the early stages of this potential. And I'm also very fascinated with the way that you research, because we have talked about it a lot, is that you decided that instead of doing something and testing certain things within your clinic only, you decided to form a community of different physicians who are sharing their clinical expertise, who are sharing the studies, sharing the outcomes, sharing the protocols, and you're able to figure out how to do it the right way, because it is relatively brand new. And what is the best source of information when you actually want to help your patients? You want to make sure that you have the best probability to have the best clinical outcomes. So lots of respect to you for that. I do have a question about something that I don't fully understand, which is different types of stem cells. It sounds like one thing, it's stem cells. But then I listened to your interviews, and there are many different kinds. And even stem cell IV therapy involves not only stem cells, but also some other cells that you are including in the IV. It's very confusing to me, but some physicians watching, they may be interested in the differences.
Well, that's probably why sometimes we want to just refer to it as cell therapy. So it's really using cells, because some cells may not be the quintessential stem cells anymore, but they're still primitive cells, and they have a lot of power to help you regenerate. But when it comes to stem cells, the first fertilized egg, of course, has all the potential there is, can produce, your eggs and sperm in the new organism, and can produce the whole placenta and the organism itself. So it has all that capability. And as this cells start to divide and form different structures, so that the progeny of this first cell will start to gain new functions. They will still gain new characteristics, new surface receptors, and mark them as, something a little different. And they'll have different functions. initially they're all stem cells. They're still, stem cells until really end organs are formed. Let's say your liver, right? You end up forming liver cells and all the linings. So you have end organ tissue specific cells. But before that, all those are stem cells because they all have the capability to produce eventually the end organ cells. So in all your organs, doesn't matter what it is, you have stem cells. Those are called tissue specific stem cells. These cells will regenerate those, basically replenish. If you damage something, let's say your skin, your skin stem cells will be able to regenerate the new skin cell. So these are very, very downstream, like very specific and limited stem cells. But when you trace it back, the further back you go, the higher capabilities they have and the more they can differentiate into. So the first fertilized egg can differentiate, can become any cells, right, including the placenta. And then when you get from cells from the inner cell mass, that's day 5 to 7 of after fertilization, the cells that you get from the inner cell mass can only form cells of the organism. So it can't, it doesn't form placenta. And that's the embryonic stem cell we're talking about. They take a cell from the inner cell mass, just in this ball, and they take that out. That has potential to form cells for all your organs, to form the entire human body. So that is very powerful. And as those cells just start to divide, they lose more and more potential. So they may divide into different layers. We call them germ layers. There's ectoderm, forming your skin, your nervous system, the mesoderm, your musculoskeletal system, and certain organs. And then the endoderm, some more internal organs, digestive system. So all these layers, they will have specific orientation to become certain types of, as far as where they are in your body. So the mesenchymal stem cells is kind of a special category. It's a little bit confusing because when we say mesenchymal, it's referring to the mesoderm. So that's the middle layer of the germ layers. But these cells perform a very specific function because they are everywhere in our body. So even as we have matured and throughout our life, we have these mesenchymal stem cells all over our body. So these are fairly new discoveries. Actually, the Dr. Kaplan, who discovered these cells, he was not happy about calling these cells mesenchymal stem cells. He has been talking for years about changing it to medicinal signaling cells. So medicinal signaling cells, that's still MSC, instead of mesenchymal stem cells, because he said, no, these are not quintessential stem cells. These are signaling cells. They provide, it's almost like this internal doctor, right? That's why it's medicinal, that it's everywhere in your body, because wherever you have blood supply, these cells are covering all your blood vessels. So they're hovering around the blood vessels. They are sensing what's going through your blood, and they're sensing what's going on in the local environment. They have this ability to coordinate what they need. If the local tissue needs help, they can send signals to the blood to get different immune cells to come over and help with local tissue. But if someplace else has problems, they can also squeeze themselves into the blood vessel and swim upstream to the area, and then have this, it's like a new army arriving, right? And then they can start working in that area, sending signals through the blood, but also kind of triggering the local stem cells to come to life. So give them just the right signals so they can start to replenish and repair and set up, produce new tissue. So that's what they do. Very special category. And this is kind of the gold standard. Currently, I think stem cell therapy, we're still at such beginning. We are infants when it comes to stem cell therapy. We're tapping into this incredible intelligence. At one point, I don't know how many years down the line, we're going to be able to take, a cell from your skin, revert it back to embryonic state, which they are doing already. But the problem is that they couldn't control them because they have a tendency to form different this type of tumor called teratoma, because they can go haywire and have uncontrolled growth of all these tissues and forming a ball of tumor. So we're having trouble controlling it. But at some point, we're going to figure it out, and we're going to be able to direct the cells to form different tissue specific cells. And, that's going to be really, really fun. But the mesenchymal stem cells modulate your immune system. I think that's always going to be a mainstay of stem cell therapy because of how they talk with your immune system and how they coordinate repair in your whole body. So that's always going to be around, no matter how sophisticated we get with stem cell therapy. When we try to target more tissue specific, you need the right environment. There are some stem cells that are really powerful, like B cells, some people talk about, but they still need the right environment for them to come to life. So even though they're pluripotent, which means they're very powerful stem cells, if you don't have the right environment, they would just stay dormant. They won't come to work for you. So we need the environment, which is what MSCs can help.
So thank you so much for explaining this, because I think it's confusing to a lot of people. And right now we find out that one name is actually maybe not the best name for it, because it's more about the signaling mechanism that is getting there. Very, very interesting. I wanted to ask you if there is a physician maybe asking a question, where do we actually get them from in terms of the process? I know that there are a lot of myths and a lot of misconceptions about stem cells. Like, what actually happens for somebody to receive these stem cells? Where are they actually coming
Well, first
from?
of all, a physician has to decide what to use, what kind of stem cells to use. So you can obtain stem cells from the bone marrow, which was the first stem cell therapy we did was bone marrow transplantation, and then realize, oh, there are stem cells in it. But these are mostly hematopoietic progenitor cells. There's some mononuclear cells, which are primitive, immature immune cells, and there's a tiny, tiny, tiny amount of mesenchymal stem cells. So they're still helpful. There are a lot of studies showing that they're beneficial. There are still doctors who are doing it who are swearing by it because there are clinical benefits. So that's one way you can do it. But another way is using fat-derived stem cells. So it's really had nothing to do with fat. It's really because when they harvest the fat are nourished by all the blood vessels. So when you try to separate out the cells that's hovering the blood vessels, you got all these MSCs, right? So you get a significant amount of mesenchymal stem cells, and you can use that for therapy. So these two sources are called autologous. They're from a person's own body. So which means that they are the age of the person. So if you are 50, great, your cells are, declining for sure. If you're 70, then they've carried, toxicity, DNA damages, and other forms, genetic changes that comes with the cell, mitochondria, dysfunction, and they have short telomeres. They don't have as many generations left. So that's just the fact of what these cells are. So you can choose to use your own or choose to use something called birth tissue derived stem cells. So there are different sources, there are different compartments of birth tissue. There is the umbilical cord, there's amniotic membrane that's covering the placenta and the cord. There's the umbilical cord tissue itself. There's the umbilical cord blood that contains things that are very similar to the bone marrow. And then you have the placenta itself. So you have all these different compartments. You can get cells out of these. And I have a video called Are All MSCs Created Equal on YouTube, where I go into, is a 40-minute lecture. I go into the science, because that was my pursuit, which was, which one is better? I'm given the responsibility of picking a good source for my patients, and I'm going to figure this out. I want to give them something that's the most effective and safest. So if a person, someone goes through the lecture with me, you will see the evidence all around the world comparing these tissue sources. And to me, at the end of the presentation, which I went through many studies, and none of them were my opinion, right? It's all about what people have shown. It has shown that the birth tissue derived stem cells, not only they have longer telomeres and more generations left, they have more potential to divide into different types of cells, much wider range. They also have higher anti-inflammatory activities. They have better immune modulating properties. And they just, they're basically, they're metabolically more active. When you look at, a lot of people want, pluripotent stem cells, cells that have more potentials. What's interesting, or embryonic stem cells, which, we can't use legally in this country. But what's interesting was that these young cells in the birth tissue, when you look at their surface markers, they are kind of in between the embryonic stem cell and the adult stem cell. So adult means a fully grown human, which includes the baby. The baby, embryologically speaking, is an adult. So these cells that's trapped in the birth tissue when the baby's forming is actually more primitive than what's in the baby. So they have kept a lot of the earlier characteristics, including some of the, most interesting genetic markers that shows their capabilities to become different cells. So these are more powerful. And what's interesting, not just that they're more powerful, that I'm such a proponent of them, it's also because they're safer. So if you look at, there's one study I was citing, they took mesenchymal stem cells from the fat of an adult, and then mesenchymal stem cells from the umbilical cord, and they put it next to cancer cells. So these are actually a very virulent form of brain cancer called glioblastoma multiforme. So very severe form of brain cancer. So these tumor cells, they put it next to the MSCs on a petri dish, and also on a live animal. So on a mouse, they put it next to tumor cells and see what happens in a live animal. So in both cases, the MSCs that came from fat made the cancer grow. The MSCs from the umbilical cord start to shrink the cancer and make them go away. And this is how powerful it is. And this is one reason that I feel like if I'm going to be a responsible provider, this is something that I need to let patients know, right? And first of all, I'm going to choose a form of treatment that can help, reduce the chance of cancer. And also, I need to educate the patients. If you want to do your own stem cells, just be aware your own stem cells are your own age. And because they have aged, they have lost certain level of intelligence. So they can't tell that this cell next to it is actually a cancer cell or have precancerous changes. And because it thought its role is to make everything grow, I call it cellular dementia. So as you get older, your cells are also getting older and getting a little demented. So it can't tell when the younger cells right away is able to tell, there's something wrong with this cell. So that's why I'm choosing birth tissue. So if we're talking about birth tissue source, right? So I don't advocate, I respect doctors who are doing, other cell therapies, using bone marrow or fat. I think when a person, especially when a person's younger, younger than age 45, I think it's okay. But I just think there's no reason to use your own at this point, because, first of all, if you want to do any IV infusions, and when you just create a trauma, you get your bone marrow out, or you do liposuction, you create trauma. If you do IV infusion, that's the first place the cells are going to go, because you just created fresh new trauma. So they're going to try to repair it. But also your own cells are not as powerful as these cells. So a lot of people are worried about, oh my God, there are other people's DNA in my body. So watch my video, other people's DNA in my body, on YouTube. So just look it up. I talk about, the implications and what they found, how it's actually part of human existence. Humans throughout history apparently have been exchanging DNA with each other, and 60% of women actually have Y chromosomes in their body, which is astounding. And probably, the way they were analyzing it, their conclusion is it can't be just from giving birth to male children or having a male sibling that possibly died, in utero, but probably from sexual intercourse, there's DNA exchange. So DNA exchange is already a part of human existence. And when I give people cells from another human, right, very, very young primitive cells. So first of all, these cells have no surface markers that mark them as somebody else. And if they do try to differentiate, sometimes your immune system will take them out. But sometimes they do stay and help you regenerate your organs, regenerate your different tissues. And they've actually shown human cells staying in other animals. So they could stay and help, start to become part of your body, start to, including, there's one study just came to mind, they give this diabetic, type 1 diabetic, I think was animal model. And then they were able to show regeneration of the pancreas. And they showed that some of the cells differentiated into the pancreatic, the insulin producing cells. And some of them actually started, in the liver, which is really strange, but they were doing the same function. So they were just producing insulin in the liver. So it is funny, but so they can stay in the body. But I would say this is $1 million question I've asked some of the most prominent stem cell scientists, around the world. No one knows how many actually end up staying, but probably between 2 to 5%, no more than that. So if they do stay, that's, very small percentage actually stay. But really, we're not counting on their mechanism of action as differentiating into your fresh new cells. We know the way they work, in the last 10, 15 years of research is consistent. If you read articles, it's like you're bombarded. Every article is saying, okay, we realize that the way they work, has helped this condition. Apparently it is not because they became the cells of that organ. Apparently it's through this paracrine function, which is really, changing the local environment and probably telling the local stem cells to come to life and start regenerating. So, and then it talk with your immune system. And so this coordinated effect that on regeneration, and it's not because they're going to differentiate. So anyhow, so that's a, long-winded explanation of what happens when you put a foreign cell in your body and what can happen. So back to your question of where they came from. So if they came from birth tissue, that means they came from live healthy births. That's I did start, like you mentioned, Chara Biologics. So that is a company that I wanted to make sure. I saw a lot of bad players in the field. Unfortunately, a lot of people, I think their priority is to make money. My priority is to heal people. But and if you provide value, yes, you're going to make money because you're contributing to the world. But I see no reason to put money before value. And that's what I've seen again and again in this industry. And it really was very upsetting to me. That's why I thought, you know what, I guess I just have to do it myself. I need to be the gatekeeper of quality. I need to make sure that people are getting what they're promised. So anyhow, so our company, we get live healthy births only from cesarean section. I don't know if you have children, so you observed the birthing process. Mm-hmm. Yeah, so it's a very chaotic, very uncontrolled process, and the vaginal canal and everything that comes out of all the orifices, it's a lot of contamination going on. So we only accept scheduled, elective C-sections, because then you're keeping a surgical field that's completely sterile. And so once we clamp the cord and we get the birth tissue, we put in a normal saline bag, and then it's overnight shipped to the lab. And we're actually going toward the direction of only getting fresh cells from the neighboring clinics. So that is within a couple hours before the birth and the processing. So we want to stay above and beyond. And because they're considered tissue transplant, they're under the governance of American Association of Tissue Banks. So because they're minimal manipulation, there's no expansion, there's just no chemical interference. They are considered a tissue transplant, not a drug. So they're FDA says, okay, if you do that, it's considered Section 361 product, then it's a tissue transplant. So these products will be screened the same way as the organ transplantation products, right? Any organ that you want to transplant will go through the same screening, or the blood transfusions, they will go through the same screening, HIV, syphilis and hepatitis, EBV, blah, blah, blah. But we do even more. We check even Lyme disease, COVID, and Chagas and prion disease. So we go above and beyond. And we're also doing genetic analysis. So we want to make sure that these donated tissues are free of these, contamination. But even before they're accepted for donation, they go through a very strict screening. They're asked to fill out a questionnaire on their personal health history, their family history, their work history, their travel history, their toxic exposures, their sexual history, their partner's history, and prenatal history. So everything is screened. And all these are women who are under age 30, who have gone through regular prenatal care in the United States. We don't take anybody outside of the United States. So then you can ensure that you're assured of the quality of the prenatal care. Everything was checked. So that's how we obtain the tissue. And once the tissue is processed into a cell suspension, right? So they're all separated out from their tissue carefully, mechanically, and then they are in a suspension. The final product is going to be cryopreserved by lowering the temperature by 1 degree per minute. So the cells are not, going through a shock. They're just slowing down their metabolic activity and until the point that they were suspended in animation, and then they're frozen. But so that final product, frozen product, is going to be sent to a sterility lab where they will test for any potential contamination introduced when you were processing. So they would take them a couple weeks to grow the cells, to see if any bacteria, anything grows in there, any endotoxins that can be produced. So only when that came back completely clean, then the labs can, basically sell the product to physicians.
Wow. So the process is very important because we need to ensure the quality of these cells is preserved, and even that they're screened and not even accepted if the quality is questionable. So thank you so much for explaining this. I had no idea that it goes, that this is exactly how the process goes. Also, thank you for bringing it up before, that the quality or the type of stem cells used for a specific type of treatment can be drastically different outcomes. So for example, like you mentioned, the fat-derived stem cells can grow a tumor while other types of stem cells can shrink it. So the correct selection of the product makes a huge difference. And for us, as on the provider side in the group, making sure that we have the quality products, that this is basically the reason why people are in medicine or in health, is to help patients. And like you mentioned, there are some people who put the monetary value and money over quality. And that's why I wanted to invite you and introduce you to people, because I know that if there is a lot of research, a lot of studies, yes, nothing is for sure. Yes, somebody can make a mistake sometimes. However, if you have such a good process and you do it for a long enough period of time and you actually do your due diligence, the likelihood of having a very good product is very high, and that's what people need. So if somebody is watching this and maybe they're an integrative medicine provider and they are thinking about having stem cell potential for their practice, right? So one way to do it would be to collaborate and to cross-refer and find a good practitioner. So one of the things that I would encourage you watching, if you're watching this and you're a physician, is you can connect with Dr. Joy and ask who is close to you, who you can collaborate with, because she has a very good network of physicians. Another question that physicians may have that I really wanted to ask you, because I'm super interested how to actually do it, is how a physician that already has a practice can implement regenerative medicine and stem cells in their own practice. What would you say are some of the steps that somebody needs to take?
Yeah, I've helped a lot of doctors to do just that. So first of all, the physicians, needs to proper education, right? But I do see a lot of doctors who go into stem cell therapy because it's such an elegant treatment. And it's, if you put in the body, the cells have potential to find where things are, and they're able to fix the problem. But there's still a lot of nuances, and that's the problem. A lot of doctors think is simple, is easy, and they just go ahead and do it, and then they're missing all these nuances. So they're missing a potential of promoting better therapeutic results. And I think it's important for doctors to be educated. So this is why I started to teach this course called Fundamentals of Stem Cell Practice. So these are just fundamentals. Any doctor who's doing stem cell treatment needs to know, what are all these, stem cell types, and what are the comparisons of these different, compartments of different tissues, and what kind of treatments have been shown to be helpful, and in what kind of conditions. And how are the protocols, what kind of protocols can you use for different type of conditions? So all these are in that course, and I do have it online now, which is make it a lot easier for doctors. They don't have to fly in to come and do the course with me. So that is one thing. And then also they can come to my clinic, maybe get a stem cell treatment themselves, experience firsthand what it can do for them. And then I can show them the entire process and teach them every step of the way, because there are a lot of details that are missed by many doctors who are doing stem cells, including if they're doing IV, a lot of doctors are just putting them into a syringe, diluting in a 10 cc syringe and shooting the vein, and that is not good. This is, the research have shown that MSCs have the potential to cause hypercoagulatable state. So you can cause more coagulation if the cells are too concentrated. You need to dilute them to certain factors, and you need to use proper filters, because the cells have a tendency to find each other and make clusters. And if you have a ball of 10 cells as a cluster, they can cause an embolism. So you want to have a proper filter that's going to break the cells into single cells, so you don't have that problem. So there's, these very small details, but the devil is in the details, right? So, we need to tell doctors. And then if you're targeting the brain, how do you open up the blood-brain barrier so more cells can get into the brain? So, and then how do you approach joints? Larger joints, smaller joints, they're targeted differently. So all these nuances, I'm happy to support doctors, and I do that all the time. I love working with doctors, partially because I want to see them making a difference and then tell me about it. I want to hear the stories, because nothing makes me happier than just hearing what people have gotten out of this.
This is awesome. This is really promising, really fascinating, and also it's a good message for doctors that sometimes it's there's a shortcut available, because somebody already went through years of research, years of collaboration with other physicians, and being able to see what's working, what's not, what's good, what's better, what's risky, and what's safe. And I think this type of knowledge is very valuable, not only for us on the practice side, when we have our group and we talk about physicians' responsibility to have the best care, but it's also so important for every patient's and their family as well, because there is an implication, like we say the disease has disappeared, for example, or has been put in remission. That's great, but what it means for the family, it means a lot, because the whole family life can change. What are some of the types of practices that can introduce stem cell therapy into their practice? For example, what is the prerequisite? What is the requirement? They need to have X to even consider it.
I think as long as they have a medical license, so MDs, DOs, nurse practitioners in some states, and naturopathic doctors in some states, as long as they can inject people, potentially they can do the treatment. And it's very simple, very elegant. I think, of course, there can get complex, but IV therapy is very simple. I think people who are already doing integrated medicine and holistic medicine, there are fantastic functional medicine, because they are already addressing the fuel for the engine, right? So they're optimizing everything. And then if they just add the stem cells, boom, you see a qualitative jump in the response, in the results of patients. So I think it can be very exciting and very inspiring for these doctors to add to their practice. And then other doctors, there are some doctors who are more open-minded in every specialty, you see these doctors. It can be neurologists, because neurology is a frustrating field. That's why I didn't go into it, even though I love the brain, because I realized there are no tools. You can diagnose, but that's where the buck stops. Your medications barely make a dent in all these conditions. They just continue to decline. So I wasn't willing to have such a frustrating career. But neurologists can do it. Rheumatologists who are seeing all these patients who are just putting them on immune suppressive medications with tons of side effects. I think they can help people to make drastic changes. I've gotten people. I've treated a patient with lupus, and she, within 2-3 treatments, her lupus markers was clear. This is back 5 years ago. So she's still lupus free. I mean, this is powerful.
Amazing.
You don't see that in conventional treatments, right?
No, they will tell you that you can only hope to put it in remission, and most likely it's going to be back. However, it's the most frustrating thing. I know I have our own personal story here in our family dealing with some autoimmune issues. I know that the conventional medicine was, unfortunately, we were hopeful, but they were not able to help us. So this is extremely promising. I know that it means a lot for many families. It also means a lot for the doctors watching, because if you're watching this, you may have another tool in your toolbox, either as a collaborative partner, that you can collaborate with somebody who does stem cell therapy and regenerative medicine the right way, or you can possibly implement it in your own practice. And I think connecting with Dr. Joy will give you a lot of resources. So follow her on social media, watch her YouTube channel as well, because she has a lot of educational videos and interviews with a lot of very interesting and helpful people who are here to collaborate. Dr. Joy, where can people find you online?
My YouTube channel, just Joy Kong MD, that's a good place. And then my clinic is Uplyft Longevity Center. So the website is uplyftcenter.com, Uplyft with a Y. And then the academy, which I highly encourage people to check out, is aaict.org. So that's American Academy of Integrated Cell Therapy, AAICT. And on there are some clinical excerpts. There's some case studies. So a lot of them are cases that I've treated, and some are from doctors who I've worked with. So there are a lot of case studies that may be really interesting and inspiring to take a look at. So I think those are good resources. And
Awesome.
of course, they can follow me on Instagram, just Dr._Joy_Kong, Kong. So they could follow me or, send me a message.
That is great. And thank you for being open to collaboration with other physicians. I will tell you, sometimes when health is not there, or it's, it's giving us trouble, we feel like we are suffocating, and you are bringing the breath of fresh air. And thank you for doing that for our group. It is awesome to have providers like yourself. And I highly encourage that you connect with Dr. Joy. Like the video if you like it, share it with other physicians if you have somebody who is interested. Collaborate, connect, and let's help more people together. Thank you. Thank you, Dr. Joy.
Right. Let's do it.